When we think about tumor boards, which is a sort of a classic form of a multidisciplinary forum, I think it just cuts down the time for our patients too, because we make these treatment decisions and then we can sort of direct patients in the correct ways rather than having them see everybody at different times.
So I'll be brave if you're brave.
Dr. Doss, you mentioned multidisciplinary teams. Can you explain what that means to those that might not understand, and also talk about the importance of tumor boards?
Yeah, so I think when we think about multidisciplinary teams, we're really talking about engaging a lot of the different care teams to really individualize treatment plans for patients. And so when we think about tumor boards, which is a sort of a classic form of a multidisciplinary forum, we have our medical oncologists, usually several of them, specializing in thoracic oncology. We have our thoracic surgeons. We have our pulmonologists. They're typically the ones who perform the biopsies for our patients and can determine whether a lesion can be biopsied or not when we're reviewing that at our tumor boards. We have our radiologists, who are incredibly important. And even within radiology, we have a chest radiologist and we have a nuclear medicine radiologist. The radiologists who specialize in reading certain types of scans. We have our radiation oncology colleagues who are also determining whether something might be suitable for radiation treatment. So it's really bringing all of these doctors and advanced practice practitioners together in a room, virtual now. It used to be in a physical room, but now we're all meeting virtually to discuss cases that require multidisciplinary input. And so we're hearing from every different specialty and really trying to come up with the best sequence of events for a particular patient. If you can imagine, at any given tumor board, they usually last about an hour. We're typically discussing 20 or more cases, so it's not that we can spend a whole lot of time, but we go through it. We're pretty efficient. We go through each case pretty efficiently. We work together so often now. It's usually weekly that we meet, that we can sort of anticipate what the other's going to say. But I think it's really important. You know, it's not, you wouldn't go to a medical oncologist to get a surgical opinion. You really need to hear that from a surgeon. And so we do want to make sure our surgeons are there providing input. And then if we are recommending surgery, that, you know, if that patient is my patient that I'm seeing in clinic, I'm going to refer that patient subsequently to see a surgeon. And so this is where I think it just cuts down the time for our patients too, because we make these treatment decisions and then we can sort of direct patients in the correct ways rather than having them see everybody at different times, if that makes sense.
Yeah, it does.